Learning to start an IV can be a daunting task for any nursing student, but with the right technique and lots of practice, you will be able to start IVs with confidence. The first step in starting an IV is gathering all the necessary supplies. You will need gloves, an 18-gauge intravenous catheter, a 6-inch lock, and a 10 cc syringe of normal saline. A tourniquet, alcohol wipes, an opsite, tape, and possibly hair clippers. Make sure that you have access to a sharps container for disposal of the needle. As with any procedure, be sure to wash your hands thoroughly before you begin. Be sure you have all the supplies you need before you start the IV. Lay the supplies out where you can easily reach them. The most important part of starting an IV is choosing a good site. IVs are like real estate. Location is everything. Knowing how to find a good vein is crucial to a successful IV start. First, tie the tourniquet on the upper arm. This causes the veins to swell slightly, making them easier to find. Be sure to tie the tourniquet so that it can be released easily with one hand. The first place to check for a vein is in the hand. Looks can be deceiving, so go by what you feel, not by what you see. Find a vein that feels plump, one that is firm yet gives. The vein should also be relatively stable, without moving too much under the skin. You can also check the forearm and the antecubital, as well as the other arm. Be patient. Finding a good vein can take a while. Once you find a good vein, you are ready to start your IV. If you didn't find a site right away, you should untie the tourniquet for patient comfort. You've gathered your supplies, you've found a site, now comes the fun part. First and foremost, relax. Get a chair and sit down if you need to. Talk to the patient. This can help calm their nerves and yours as well. Tie the tourniquet above the elbow, and make sure to tie it so that it can be released with one hand. Find the vein you picked. If the patient has a lot of hair at the site, you may need to clip it so that you have easier access to the skin and so that the site can be secured with tape. Clean the site with alcohol wipes, rubbing vigorously. Now you are ready to insert the catheter. Hold the catheter in your dominant hand between your thumb and your middle finger with your index finger on top. With your non-dominant hand, secure the arm and skin around the site, using your thumb to pull the skin taut. Insert the catheter at a 45-degree angle. After puncturing the skin, lower the catheter to be more parallel with the vein. Enter the vein. You might feel the vein pop slightly, but not always. Once you enter the vein, you will notice blood return in the hub of the catheter. Advance the catheter approximately 2 millimeters. With your index finger on your dominant hand, thread the catheter off of the needle and up into the vein. Occlude the vein above the catheter with your non-dominant hand. Then you can release the tourniquet. Pull the needle from the catheter, ensuring the needle's safety device engages. Attach the lock and syringe to the catheter with your dominant hand. Make sure the luer lock is tightly secured. Flush the normal saline through the lock and the catheter. Remember, your non-dominant hand should still be holding the catheter in place. Secure the catheter by placing the opsite over everything except the clamp on the lock. Use tape to further stabilize the catheter and the lock. Let's get a closer look. When you're ready to insert the catheter into the skin, remember you're really making 2 pokes, one poke into the skin and one poke into the vein. Advance the catheter into the vein and thread it off the needle. Make sure your non-dominant hand keeps the site secure. Attach the luer lock and flush with the saline. Secure the site with the opsite and with tape. Your IV should look something like this. When it is time to attach the IV fluid, wipe the luer lock with an alcohol prep pad. Unscrew the cap from the IV tubing, being careful not to contaminate the sterile tip. Screw the IV tubing to the luer lock. Make sure the connection is secure. Now tape the tubing to the patient's arm to prevent it from getting tangled. Be sure to dispose of the needle in a sharps container. Now, clean up your mess and wash your hands. That's it. You've done it. You successfully started an IV. Let's review. When starting an IV, you should first gather all of the necessary supplies and arrange them so they are easily accessible. Take your time and find a good vein. Go by feel, not by sight. Insert the catheter using your dominant hand, securing the site with your non-dominant hand. Once the catheter is in the vein, thread the catheter off the needle and attach the lock and syringe. Remove the tourniquet, flush with saline, and remove the syringe. Finally, secure the site with opsite and tape. When attaching IV tubing, clean the luer lock with an alcohol prep pad. Attach the tubing, being careful to keep the tip sterile, and secure the tubing with tape to the patient's arm. It's important to remember that starting IVs takes lots of practice. The process will become smoother and easier with time.